Germany's biggest private hospital operator. But first, this report.
The patients just keep on coming. The coronavirus outbreak is testing the limits of hospitals all over the world. The demand for beds, respiratory equipment, protective gear and workers continues to surge. Many former medical professionals have been called back on duty, like a qualified doctor, the Irish Prime Minister.
As you know, I rejoined the medical register there last month, and I'm setting aside really one session a week, about half a day a week. So far it's just been a telephone clinic.
The virus, which has infected politicians, celebrities and business leaders, is often described as indiscriminate. But as hospital staff get to work, inequality reigns. Poorer people are more likely to catch the disease, and they're more likely to die from it. That's led to calls for a lifting of the barriers, for example, between public and private hospitals. In Spain, one of the countries worst hit by the crisis, the government has ordered private clinics to share resources with the public system. Australia has pushed through similar measures. In Germany, meanwhile, some private clinics have reportedly applied for government support to compensate for the cancellation of lucrative procedures. But they simply aren't a priority right now.
For more, I'm joined now by the CEO of Fresenius, a global healthcare group with more than 290,000 employees in more than 100 countries. And here in Germany, Fresenius is also the largest hospital operator. Welcome, Stefan Sturm. Good to have you with us. Tell me, how are your hospitals holding up in this health crisis?
We're going to differentiate between the situation in Germany and Spain. We have 86 hospitals in Germany where we're still waiting for a large wave of corona patients to arrive. On the other hand, we have 44 hospitals across Spain, where in particular in the hotspots in Madrid and Barcelona, we have had more than our fair share of patients to deal with.
Right. How big a role, I mean, it feels awful to talk about money in such a situation, but how big a role does money play when it comes to providing good health care?
Well, we have got to see that fatality rate in Germany is substantially lower than the one that we're seeing elsewhere. But I do believe that first and foremost, that has to do with quite a few issues that happen outside the hospital. So when it comes to the amount of testing that we're doing, the denominator in that fatality ratio, Germany has done substantially more, as far as I can see, than most other countries. But also when we look at the numerator, I believe that in Germany the patient population on average is substantially younger than elsewhere. A key reason for this may actually be a cultural difference, where I think it is more towards the German culture to keep some natural social distance relative to what we can observe in Italy and in Spain. When it comes to the money, capital allocation to a hospital system, then I do believe that Germany is a bit better equipped than what we're seeing elsewhere. And as far as our own hospitals are concerned, we have invested quite heavily in the past. And we can now also afford to shift resources within this large network to wherever they are needed.
Right. As you just mentioned about shifting resources, you do run private hospitals, and private hospitals, as in their nature, they need to be profitable. Is that a problem now, given that treating COVID-19 patients is very time and very cost-consuming?
No, and this is not the time to think about market share gains or profitability. This is the time to think about how we can best help the society. As it was mentioned a bit earlier on, yes, the Spanish government has drawn on resources to help out, and we are more than happy to do that. I believe that, yes, whilst we're still waiting in Germany for actually, we're not waiting, but we haven't seen a large wave of corona patients yet, and therefore in many of our hospitals where we have followed the minister's appeal to delay any elective surgery. Yes, we're seeing an underutilization of capacity, but that is obviously absolutely fine. We've got to see through this crisis now, and everything else is going to be taken care of afterwards.
That is definitely an almost luxury position to be in, the one that you describe here in German hospitals. And so you mentioned it, that so far Germany's health system managed to keep the number of COVID-19 related deaths fairly low, certainly in comparison to other countries, but the number of cases keeps rising. Now, as the CEO of Germany's biggest hospital operator, how worried are you that maybe you will not be able to cope with the influx of patients and have to make hard decisions?
This has been a very, very dynamic development that frankly is beaten to my expectation. So I will be cautious with making definitive statements, but at the same time, Germany has had the luxury of being somewhat late to this, and therefore we have had the opportunity to learn quite a bit from what worked in other countries. As an aside, we have also had quite a number of volunteers in our German hospital system to go down to Spain and help out our colleagues over there. And those who are returning now have real-life experience as to how we can better combat this crisis when it truly arrives here in Germany.
Right, Stefan Sturm, CEO Fresenius, thank you so much for your time, and all the best to you, and certainly for your medical staff in the coming days and weeks.
Thank you.